Right now, a nursing shortage is hitting Arizona hard.
This morning, a local nonprofit that offers home health services telling us they're turning patients away because they do not have enough nurses. Jen Wall joining us live this morning, putting this problem and some solutions into focus for us. Jen?
Yeah, good morning to you, Scott and Emily. This one's hard to hear. Going inside of FSL here, it is a nonprofit that serves mostly our aging population here in the Valley for healthcare needs during the day. That's so families can go to work and do their normal daily tasks. Well, they tell me that they are raising wages and they're offering a sign-on bonus to help attract nurses so they can serve more patients here in the Valley. But even with those forward steps, they're proving to be challenging for FSL, who says it's tough to compete with all of the healthcare agencies trying to hire nurses right now locally. FSL nurses work a weekday schedule. The nonprofit's Health and Human Services Administrator tells me they're offering a $5,000 sign-on bonus right now, and they've also increased pay, in some cases about 61% of where they were just 2 years ago. So the pay scale is anywhere from about $65,000 and $95,000 a year. And the nonprofit says they're also working with local universities to fill the nursing shortage they're experiencing. They're trying to reach the reported 33 to 57% of nurses who have left the field within their first 3 years of work. And this morning, an FSL nurse also weighs in on these staffing issues.
By 2030, we're going to see 1 in 5 individuals over the age of 65. And what that's going to do to our healthcare system as a whole and the pressure that's going to put on us is going to be something that I don't think we're fully prepared in understanding today. And that's why it's so critical that we gain awareness of how important our nurses are to the infrastructure of our healthcare system.
It's a little bit difficult right now. We try our best, but sometimes we're just stretched a little too thin with the staffing that we currently have.
So another concern that FSL shares is here in Arizona, once our aging population, when that 65-year-old population hits the 75-year-old mark, they do expect medical needs here to increase exponentially. And combine that with a high percentage of working nurses right now in their 50s, a lot of those expected to be retiring in the coming years. So a big problem if this nursing shortage is not addressed and fixed. For now, we're live in Phoenix. Jen Walt, 12 News Today in AZ.